So now the side effects with these sort of higher doses, are you seeing side effects? What side effects do you see?
I'm seeing some transient side effects. If you've never taken ivermectin before and you start at 1 milligram per kilogram per day, for a 60 kilogram person, that's 60 milligrams of ivermectin, you may have some transient visual symptoms. The visual symptoms have been described as seeing colors a little bit more vividly or seeing a little bit of stars. It's almost as if when you get up too quickly and you have that effect that you might faint. So there's been visual symptoms described. Now, these are temporary. They may last anywhere from a few minutes to a few hours, and they do go away with time. After 1 or 2 weeks of ivermectin use, the body seems to get used to it and they go away.
Even maintaining the same dose of ivermectin.
Exactly.
Right.
And so there's reports. I mean, there's reports in the literature of ivermectin being used at 1 milligram per kilogram for up to a year with no side effects, and there's been no long-term effects reported with ivermectin use either. Now, if
no non-reversible neurological effects that you've ever come across.
None. Now, you could push the dose higher to 2 milligrams per kilograms per day, but you have to be cautious when you go to those higher doses. Now, I've had some successes going to the higher doses, especially with very aggressive cancer, pancreatic cancer, for example. I had a patient who cleared his pancreatic cancer with a few months of ivermectin, 2 milligrams per kilogram per day. But there you can start to get, especially in more elderly patients, you might get some confusion, you might get some instability on the feet. And so you have to be more careful going into the higher doses. Again, ivermectin has a half-life of 18 hours. So if you do run into some side effects, you stop, it's out of your system within 2 days. And again, no long-term effects. But you have to be a little bit more careful with ivermectin if you want to push the higher doses.
I did hear, I think it was on Joe